Hi, I'm Roger Mashad. At Franklin Templeton Investments, we believe that citizens need to be informed about the resources that can help make higher education more affordable. That's why we're proud to support programming produced by the CAUCUS Educational Corporation and their partners in public television.
A prescription for better health, next on CAUCUS New Jersey.
Funding for this edition of CAUCUS New Jersey has been provided by Felician College, Johnson & Johnson, New Jersey Sharing Network, dedicated to saving lives through organ and tissue donation, the Russell Berry Foundation, NJM, auto insurance, homeowners insurance, and more, with a focus on safety and financial stability. NJ Best, New Jersey's 529 College Savings Plan. Turn a dream into a degree. And by Verizon Communications. Promotional support provided by New Jersey Monthly, the magazine of the Garden State, available at newsstands. And by The Record, North Jersey's trusted source, and northjersey.com.
Welcome to CAUCUS New Jersey. I'm Steve Adubato. You know, a respectful and compassionate relationship between physicians and patients, or so-called humanism in medicine, can result in better health outcomes. Here in the studio to discuss humanism in medicine, we have Dr. Brian Benson, who is a trustee with the Arnold P. Gold Foundation. Dr. Yi-Horng Lee is chief of pediatric surgery at Rutgers-RWJ Medical School and Bristol Myers Squibb Children's Hospital. Judy Schmidt is the president of the New Jersey Nurses Association, and finally Maureen Walther, his daughter, whose daughter is Sarah, is a patient of Dr. Lee's. I want to thank you all for joining us. Thank you very much. I just met your daughter, Sarah, coming in here. Put things in perspective for us. By the way, you're going to see several websites throughout this program. Sarah is a patient of Dr. Lee's.
Yes.
Okay. Describe why that is significant given the context of this discussion of humanism in medicine.
Well, we've dealt with a lot of different medical professionals, and we had a significant situation where we needed a strong pediatric surgeon.
What is she dealing with?
She has something called Rett syndrome, and so we had a GI issue, and we waited some months for a strong pediatric surgeon to come in, and we met Dr. Lee, and he really made a huge difference in Sarah's life. And
describe it, because Sarah's not verbal.
Sarah's nonverbal, so she was unable to tell us that she had any discomfort in her GI system, and our GI doctor suspected some issues and asked us to wait. For Dr. Lee to be at Robert Wood Johnson. We met him in August, and a couple of days later he did surgery, and you know, he's really changed everything about Sarah. During the time we spent there, you know, they were very kind to us. You know, they talked to Sarah versus just us as her parents, the professionals.
Is that, you know, because Arnold Gold is a great friend of this show's, and we had him on many, many times. For those of you who don't know who Arnold Gold is, Google him. You know, the internet's good for something. Google Arnold P. Gold, and you'll see why there's a foundation named after him, because he's talking to us about humanism in medicine for years. You talked about being kind to your daughter. Doctor, humanism in medicine is about being kind and so much more. Talk about it.
I think medicine is a very, very personal profession. Personal? To me. It's one person dealing with the problem of another. And really have to delve into a sort of a deeper aspect of the story. So for example, Sarah. Sarah came to me with a problem with the feeding tube. The angle of that tube's initial placement was correct, but as she grew, that angle became difficult. It's a tube that needs to be replaced every 3-4 months. And now this is essentially her lifeline for nutritional support. Right. So when the replacement is difficult, and every time this needs to be replaced, it's painful to her, and during administration of the feeds, there may be some leakage, and there's a lot of discomfort associated with this. And every time a replacement is needed, there's a lot of anxiety, probably on her part, on her parents' part. So these are the issues that I was trying to address.
But how, I understand something. How is that not devil's advocate? How is that not purely a clinical series of issues that you would deal with? How is that humanism in medicine?
Well, I think it's trying to understand how significant that problem is. To me, as a surgeon, trying to straighten out a tube, that's actually a fairly straightforward issue to deal with.
What was challenging?
But what's challenging is to understand how important that problem is to Sarah, to her family, and also to listen to her to see why this has become an issue. It's from an anatomical perspective. Yes.
You described in meeting her, she's not verbal. You said listen to her.
Look at her facial expression and listen to the parents, because as someone new to Sarah's life, I don't know how to interpret her facial expressions, but her parents do. And
so you're treating, I'm sorry for interrupting. Are you saying humanism in medicine calls out for you, demands that you treat the entire family?
We always should treat the entire family.
Always.
Absolutely.
Absolutely.
Jump back in and I'll come back to you. Did you feel like you were being, because in the middle of this,
Yes.
you
I got
you had your own
breast
health
can-
issue.
Yes, I had
Breast
breast cancer.
in the middle of
In the
this.
middle of this. And we had been waiting for a surgeon who could do this simple procedure, but, you know, I got something in the midst of it. So then we had to wait and, you know.
And Dr. Lee, did you help schedule the surgery?
I
Yes.
did.
Okay.
And actually, so there are two parts to the
Do you live
issues.
with these guys at this point?
We'd love to.
I just moved to New Jersey at that point, and so there are two parts. So Sarah came to me with a problem with her gastrostomy tube, the feeding tube.
Right.
But I think in the process we understand that there are probably more GI issues involved. There are more aspects of her care that perhaps need to be attended to. I didn't know the extent of what I do can help her, but we always give it a try.
And you had to understand more. And nurses play a role in this. And by the way, for those who don't know, the Orton P. Gold Foundation is?
www.humanism.org.
Let's put that up. But tell folks, respond to what you're hearing so far. Is this, in fact, what Dr. Gold had envisioned when he talked about humanism in medicine? Is this it?
Treating the whole patient and the whole patient's family is always a goal of doctors everywhere, I think. But the reason Dr. Gold founded his foundation in the late 80s was he felt that we were becoming enamored with technology and with procedures, and that the focus on the relationship between two people, just like you said so well, was getting lost in the shuffle. And so the term humanism in medicine was used to describe what the foundation was seeking to do. And relationship-based medicine was really one of the major goals. And so we set out to figure how we could identify people who did it well, how we could reward people who were doing it already, how we could select people for medical school and now nursing school who are going to be the type of people that are going to act that way when they become graduates of their professional school. And then we also develop programs to sustain this in both the medical school education, residency training.
Is it a movement?
Afterwards. You know, I think that the Gold Foundation
is humanism in medicine a movement?
Absolutely. Yeah. Absolutely.
Is it the dominant, what we just heard here?
Yes.
Is this, from your experience, from a nurse's perspective, and nurses see just about everything?
It's always been humanistic, holistic. We see the patients probably 10 times more than the physicians have the opportunity to be with the patients. We see them at their worst. We see the families at their worst. And it's not just the patient, it's the family, it's the friends, it's the girlfriend, it's the boyfriend, it's the cousin. We need to treat the family as a whole and not just the patient. And I think nursing has sometimes with the technology, as physicians have looked towards the technology, but we really do need to look at the person.
And no one's going to disagree with this, but and again, playing devil's advocate, there are some who are saying, wait a minute, that's not my experience with my physician, with the healthcare that I receive, because very often I don't feel that kind of connection. Very often I feel as if I'm getting very little time with the healthcare professional because he or she is moving very quickly. So let's talk about humanism in medicine in the context of healthcare delivery and the healthcare economics that we're living in. Doctor, jump in and then I'll come back to you.
I think,
how do you do it, given what the realities of healthcare economics?
I think we have to stay focused on the fact that practicing medicine is an act of humanism. We have to stay focused on that. And sometimes what we do gets lost in the shuffle, in the technology, in the business aspect of healthcare. There are a lot of external forces that kind of distract us from practicing medicine in this humanistic way. There are always paperwork to fill out, the medical records that need to be completed.
Can insurance companies challenge us sometimes?
They challenge us all the time.
All the time.
And any procedures that we propose, we need to come up with a proper justification. And I believe that we do need to justify what we do.
You have to manage costs at the same time, absolutely.
Yes. But with all these external forces, sometimes it becomes an act. Seeing a patient, oh, Sarah has a G-tube problem, take a look at it, G-tube is a little crooked, schedule surgery, be done with it.
What's wrong with that?
Well, then we miss out on the opportunity to see Sarah as a person, to see Sarah as a human being in the context of the family, and I don't think I will be able to provide as good of care.
So hold on, I'm going to be clear. By the way, what does the sign say above Sarah's bed?
It said something along the lines of...
I can tell you. It says, talk to me before you touch me.
Yes.
Because? And I'll come back to this economic
She
issue.
understands everything, despite being nonverbal. You know, don't come, you know.
Don't just start touching me.
No, no.
So
and we're advocates of that. We feel that through the years, people look at her because she's nonverbal and has this disorder. She doesn't understand. She fully understands.
She fully understands.
She fully understands.
Let's go back to this issue that the doctor raised. What you are saying, doctor, is that the kind of humanism in medicine that you describe, that you provide for your family, right? For Sarah and your family, that actually provides better outcomes, healthcare outcomes, as opposed to, boy, that's, some people are saying, oh, that's really nice that you do that. You're really compassionate, empathetic person. That's wonderful. You're saying it actually results in better outcomes. Make the case.
In the late 80s, when the foundation started, there was really a paucity of data to indicate that spending time with patients resulted in better outcomes. It's something that we all knew intuitively. And it's something that we all sought out in a doctor, right? We wanted a doctor who was going to listen to us, to, you know, to not have to have a sign to tell me, you know, talk to me first.
Right.
What other human interaction do we start off by touching? Never. You know, we look, we communicate.
Right.
And so, you know, we're seeking this out. Jump forward 20 years, we now have a funded research institute, you know, that's looking at the current data.
What does it tell us?
And it tells us that we have more work to do, but that there is very encouraging evidence that the habits and techniques that we're able to inculcate in training doctors are going to, in the long term, result in more satisfied patients, better clinical outcomes, and almost certainly more cost-effective care.
And it's clear. And nurses play...
And we can see that in nursing. If you have a patient in an ICU in a coma, and they have, their heart rate goes up, you go into the room, you touch them.
Yes.
You can see the heart rate go down.
Just by touching and talking?
Respiratory rate go down. Just by touching. Just by the humanistic or holistic component of healthcare.
It's funny, I was actually, I was in the hospital recently going through something, and the doctor came in to tell me the results of some test, and it was freaking me out. You can imagine, right? Mm-hmm. And there was another healthcare professional in the room who was just standing there, and she said, "Do you mind if I stay here?" And I said, "No, it's fine." And as the doctor was telling me the results of the test, that healthcare professional
Absolutely.
put his hand
Yes.
on my hand and never said a word. Mm-hmm. And I wasn't even aware of it, but I was aware of it. And I thought to myself, I'm not alone. I mean, it happened to be that I was there alone at the time. The point I'm making is not at all about me. It's saying, at that moment, I felt like there was someone there who was
caring.
Yeah, it's huge.
Huge.
I don't know if my blood pressure went down, but I get the point you're making.
If we hooked you up to a monitor, I'm guaranteeing you that your blood pressure went down, your heart rate went down.
So there's a direct correlation between touching someone's hand, the tone of their voice, being a certain way, compassionate, empathetic, and actually the response. You see it in your family?
Yes, absolutely.
And for your patient yourself.
Yes.
Because you were diagnosed with breast cancer in the middle of everything happening with your daughter. What were you looking for?
For her?
What did you want? No, for yourself.
What
did you want for yourself as a patient at that point?
I wanted that care that she was getting. I wanted, I'd never been the patient. She had always been that patient. I wanted that care. I wanted to be treated, by the professionals the way she had been treated. That's what I was looking for. And I got it. It was...
But here's the thing. You didn't shop around.
I went to Robert Wood was my second.
You knew where you wanted to go, though.
It was my second opinion hospital.
Well, here's one of my concerns. Information I got in getting ready for the show is that one of the problems with humanism in medicine, or the practice of it, doctor, help me on this, if people just keep shopping around, right? And you don't, with different doctors, different hospitals, you move around, whatever, who is in the network, who's not in the network, isn't it hard to establish that relationship with healthcare professionals that allows for this kind of human interaction?
I think it's up to the doctor to earn the patient's trust,
Talk
to
about that.
work to establish a relationship. So in caring for Sarah, I did not know that Maureen had breast cancer when I first met her, but that information came forth during my initial visit with Sarah. Then what went through my mind was I knew that Mom needed treatment, but she had always put Sarah's health above her own.
Right.
So my job is then try to schedule the surgery in such a way that there is enough time for recovery for Sarah.
Wow.
So Maureen can move on to her treatment.
You were thinking about the whole family and making that recommendation.
Yes. And that's really, that's to me, that's really the only way to practice medicine. We all say we go into medicine because we want to help people. But now we look at clipboards, we look at computer screens, we look at CT scans, we look at images, and even for vital signs, we look at the charts we ask the nurses.
Which are all important.
They're all important, but nothing should ever replace interacting with the patient and the family.
So let me ask you something, Brian, from a generational perspective. Do you see anything, or is there anything between younger physicians, those who are more mature and older, as it relates to humanism in medicine? Who's more inclined? What does the research show? What do you see anecdotally? Who is more inclined to practice it?
Well, I think, first of all, we know we need to identify people who have that gift.
Is it a gift?
Entering medical school. Certainly, some people are better than others. Sure.
You can learn it.
Sure. I mean, being a good communicator is a gift, but it's also a skill that you can develop. So we want to find people who have that talent, then we want to develop their talent. If you want to go to Juilliard, you have to be pretty good before you get in, but then, they teach you and then you come out much better. So in that same regard, we're looking for people coming into medical school and coming into nursing school and all the, physician assistant school.
Sure.
We're looking to identify people who have the gift, and then we have to have programs to develop it. So I don't think it's a generational thing.
You don't.
We're talking about skills of communication, empathy. And there are programs that bring that out.
Are they skills?
They're absolutely skills. If they weren't, you couldn't have a gold foundation, right? Because there wouldn't be anything to teach people.
But I'm going to ask you this. You've seen a few nurses over a period of time. When it comes to caring and compassion and empathy, I've often wondered this. You get somebody who graduates top of his or her class in nursing school. He or she's got all the skills, all the clinical skills. He or she graduate, I mean, they got it, right? And you look in their eyes and you watch them interacting with a patient, and they're moving quickly, and they don't make a lot of eye contact, and you know they're not really listening, but they're convinced that on the medicine, they've got it right. Can you teach them to care?
Absolutely. I think anyone who goes into any of the healthcare profession goes in it because they're caring. It's somewhere along the way they lost it.
Is it in there somewhere?
It's in there. It needs to be brought out. It needs to be mentored. There needs to be role models out there so that these nurses, physicians, physician assistants can see the compassion and the humanistic nature of healthcare.
And so someone watching right now, a healthcare professional, says, oh, this is great. Public television has this program on humanism and medicine, and I would love to be that way. I don't have the time. They're just saying, I don't have the time.
There's always time.
You say there's always time for this. You say, because you've seen all kinds of medical professionals, right?
I say
there is always time.
there's always time. They
In
make
that
the
particular day, on that particular day, you may not have the time. But you need to make the time. Because in the long run, you will do the right thing. You will ask for the right test. You will ask for the right information. You will understand the question that the patient is asking you.
Better outcome?
And then you'll have a better outcome.
Convinced?
Absolutely.
Convinced better outcomes?
Absolutely.
Talk about it for you and your family.
It's a trust issue, and I think getting to know them and, that they call it all kinds of crazy hours of the days and nights, when we ask those questions. Dr. Lee called a few days ago at some crazy hour, on our concerns. It's a better outcome for Sarah, generally. In the end, it's going to be a better outcome. We have home nurses. There's the trust factor, knowing they're doing more than just the mechanical parts of their care. They're doing the humanistic part of it.
To put this in a more tangible sort of terms.
Sure.
So I think we have established a trust.
Yes.
She knows that she calls. At some point, I will call them back. Right? So that trust is there. And I would say the issues that Sarah has right now are actually rather minuscule. But from a medical profession perspective, I know it's a small problem. But from a patient perspective, it's not a small problem. But they know, they have that trust that someone will call me back and will try to help me figure this out.
But
so what does that mean?
Time is a real key point, because the lack of time to communicate.
But that's important. You need to invest in that time. And what that means is Sarah would not go to emergency department, sit there for 6, 7, 8 hours for someone to evaluate her. And that someone is likely not someone who is familiar with her history, with her condition. Actually, so in our case, a simple phone call solved all the problems.
Instead of going to the emergency room, sitting there for 6, 7 hours.
To be careful by someone who is not familiar with her case.
And that's part of humanism medicine. Now talk about the time issue. We got a couple minutes left. To those who argue, we don't have it.
We don't have time. No, nobody said it was going to be easy to be a humanistic doctor or nurse. The key is, if you have a limited amount of time, you have to have the skills to make that time worth every minute you can wring out of it. When I was doing my pediatric rotation, there was a Gold Foundation assistant professor, Steve Miller, at Columbia, working in Peds ER. And Dr. Miller had the ability to walk into a room, meet a patient, make eye contact, and within 10 seconds, there was already a bond there, and there was an ability for the family to open up. He had that gift, but he taught that skill, and every time I go in to see a patient, I still think of Steve Miller, because he was my mentor in that way, and he showcased that ability the way that I think we should all be modeling.
That's powerful stuff. In the few seconds we have left, what would you say to patients out there who want what you just described, what should they say to their physician?
Ask for it.
Ask for what?
Their time. You know, you want their time you want the answers, you know. You want them to answer to you.
Doctor, I need your time. Explain this to me.
Yes, absolutely.
You have that right.
Yes.
Well, listen, we have 20 seconds, not much time. But I do have time to say this. I cannot thank all of you enough for being here, particularly you and your family for being here. And all of our best to Sarah, and our best to you as well.
Thank you.
Take care of yourself.
Thank you.
Thank you all very much.
Great
job.
The preceding program has been a production of the CAUCUS Educational Corporation, celebrating over 25 years of broadcast excellence. N13 for WNET, NJTV, and WHYY. Funding for this edition of CAUCUS New Jersey has been provided by Felician College, Johnson & Johnson, New Jersey Sharing Network, the Russell Berry Foundation, New Jersey Manufacturers, NJ Best, New Jersey's 529 College Savings Plan, Turn a Dream into a Degree, and by Verizon Communications. Transportation provided by Airbrook Limousine. CAUCUS New Jersey has been produced in partnership with TriStar Studios.
For 17 years, the Russell Berry Foundation has recognized unsung heroes in New Jersey who have done extraordinary things for others. If you know a New Jersey resident whose selfless or heroic actions make them worthy of recognition, you can nominate them to receive the Russell Berry Making a Difference Award. With annual cash prizes of up to $50,000, this award can make a significant difference for a very deserving person. Nominations are accepted online.